Hi, I'm Dr. Jeff Hopkins, Medical Director of the Emergency Department at Milford Regional Medical Center. I'm here to talk to you about a very dangerous trend we've been seeing in our emergency department and across the state due to the concerns about coronavirus. Emergencies and other illnesses simply don't stop due to coronavirus. We are extremely concerned that patients may be purposely avoiding the emergency department out of fear that they would be infected by coming to the hospital. That element of fear is leading to delays in care and ultimately worse outcomes when patients are putting off the care that they need. We know that patients are avoiding the emergency department at times when they need it most. Our volume is cut in half, and we are seeing patients who arrive oftentimes with complications from waiting too long and delaying the necessary care that they need. We are prepared to take care of all emergency conditions at any time. There is a misperception that the emergency department is overrun with COVID-19 patients and that we can't safely provide the level of care or don't have the appropriate resources to care for all patients with all types of emergency. This is absolutely not the case in our emergency department at Milford Regional, where precautions are in place to prevent exposure for patients, and note that we are ready to staff appropriately to take care of patients with any emergencies. The hospital has made a concerted effort to ensure that all patients are safe from the moment they enter the hospital, including screeners at the entrances, mass distributions to all patients, and a painstakingly detailed infection control process that happens throughout the hospital. We're fully staffed with emergency physicians. We're available 24/7, 365. We are able to handle any emergencies that come your way. So if you have an emergency at home and it's something that you would have come to the hospital for 3 months ago, that's a good idea of kind of what you should be coming to the hospital for now. If you thought it was an emergency 3 months ago, it's probably still an emergency today. We do not want you to delay that care because we've seen what can happen in those instances. People are afraid, and we understand that. It's a natural reaction, but what we want to prevent are patients from putting off, delaying care that they absolutely need. This can result in your visit to the emergency department leading to an ICU level visit, rather than something that we could simply take care of and send you home. We also have our primary care providers and our specialists, including our surgeons, our orthopedists, our cardiologists, our GI specialists. They are performing telemedicine visits. They can do these visits with you from the comfort of your home. There's no interaction, there's no risk of becoming infected with coronavirus with these telemedicine visits. This is another way to keep you safe. Ultimately, we want you to know that we are staffed appropriately, we have the appropriate capacity, capability, and we have the team that's ready to care for you 24/7, 365, no matter what your medical condition may be. Please do not delay or put off care due to fears from coronavirus. The outcomes can be much worse. Remember, emergencies can't wait.